All right, everyone, we're going to go ahead and get started with the meeting tonight. For those that don't know me, I'm Kristen Coates. I'm with Randolph County Environmental Health. And back here, if y'all want to introduce yourself.
Hey, everybody. I know I'm a little bit far away. I'm Andrea Brunk. All my centers very well know me. And Cindy.
Cannot unmute myself because
You could. It's
okay.
So, and Cindy's here too, Cindy Trogdon.
So we're all here to kind of go through the meeting with you. As again, a few housekeeping things, if you don't mind. Please keep yourself muted. Sign your name in the center you're with into the chat box. We are noticing some people are just putting their name, but we need to know what center you're from too. So please add that to the chat box.
First and last.
So I need first and last name and what center you're from.
We just got Leslie from
Also, make sure if you have any questions whatsoever, please put those into the chat box. Andrea and Cindy is going to be kind of keeping track of the questions that you have. And we're going to try to address those questions at the end of the presentation. If we do not know the answer to your questions, we will get those answers to you. We may not have time to answer everything at the end, but we would definitely send you out a Q&A sheet with all those questions and answers for you once this presentation is over. And it is being recorded, so we hope we can get this out to the ones that were not able to come tonight, so that you guys have all of this information. With that being said, we're going to kind of get started with the meeting. So the first thing we want to address is all of the new rules and the readoptions that have came in place. These rules have recently been changed. Not all of them, a lot of them are still the same. They've just basically taken all the memos that has been put out over the last few years and incorporated those memos now into the new rules. So they basically just readopted and added the memos. So that's kind of what we want to discuss today is the new stuff that we're seeing on inspections, and then address any questions that you guys may have. So let's start out with the first one that a lot of people have been asking us about, and that is the lead water testing, the asbestos testing, and the lead paint testing. So all licensed child care centers now and in-home child care centers and public school buildings, you have to have your water tested that is used for drinking, or making or preparing food, bottles, or drinking. You have to have that stuff tested for lead. These same facilities now also have to be tested for lead-based paint and asbestos. Most of our child care centers, I believe, we have done lead-based paint testing. So what they're telling you is you need to go to that cleanwaterforuskids.org/en/Carolina, which is up there on the board or on your PowerPoint. So make sure you go there. You have to do this every 3 years, though, especially the lead water testing. And it needs to be completed before or by your last testing date. If you do not get this back or you do not send it in prior to that testing date, it will be a 6th demerit item on your inspection. It doesn't mean that you have to have the results back. You just have to make sure that you have got it tested. So I was told by the state that you guys should be getting a confirmation email or something that they have received that your water test. So you just need to have that printed out to be able to show us that you've done it. As I said, the results do not have to be back. And a lot of these, from what I have been told, they are sending you RTI, which is the company that is doing the lead water testing. We have been told that they're sending out emails based off of priority. So whoever had lead in their water before, they're sending those out first. So what we're seeing is people are getting very close and they have not yet gotten an email from RTI saying that they need to register. So what we have been told by the state is you need to go ahead and go onto that Clean Water for Carolina Kids website and go ahead and register yourself. So you don't want to miss that deadline. If you do, as I said, it is a 6th demerit item, and you do not want that to mess you guys up. So whenever you get that report back, make sure you print out a copy and keep it for us to see, along with like your carpet cleaning receipts, your stain and sealant receipts, or the end tags for your wood. So just make sure you keep that stuff available for us to be able to see during inspections. As for the asbestos and the lead-based paint testing, that has to be done by May 1st of 2024. I think that date may be pushed out. I think they're trying to get everybody registered by that date now. So that date may not be set in stone, but they are definitely telling people they need to go ahead and get registered for that. So it's the same website, the Clean Water for Carolina Kids website. You can go on there. If I'm not mistaken, what we have been told is that it's just a questionnaire that you have to fill out. I believe, if I'm not mistaken, I don't want to tell you wrong, so let me go back down here. I think it's pre-1988. There's a certain date, pre-1988, that is asbestos, and pre-1978 is for lead-based paint. So from what we've been told as well, if you have to be lead-based paint tested or asbestos tested, they're going to do both at the same time, no matter what. So if you look at the bottom, there's a link to the wall right there, and that tells you everything that you need to know about the lead-based paint and asbestos and the lead water. We have also been told there is funding for this. If you get it done through RTI, they will have, I think it's 100% funding for child care centers, but you have to go through and fill out the paperwork for that. There is some paperwork that you have to fill out to be able to get that funding. As for child care centers that are in schools, that's a little different. I will tell you that the way the state has said, they're trying to put the child care center that's in the school and the school on the same schedule. So the schools, I know doesn't seem fair, but they are going to be put on the same schedule as the preschools at the schools. And so they told us not to mark 6 demerits on that until they're further put together. So I just wanted to let the people know that are in schools, that have in-school child care centers, that is a little different for you guys. But they're trying to keep everything on the same level. Anything else that you can think of?
No,
okay.
Right.
All right.
That's good.
I just want to make sure I wasn't missing anything on that.
Nope.
I don't know if there's anybody here that is in a private school that has a child care center. If you are in a private school, the child care center still has to be lead-based paint tested, lead water testing, and asbestos testing. I have been asked by quite a few that are in those private schools, are we included in this? And unfortunately, if you have a license of any kind, you are included in that. I've been asked what is going to be tested. From what I've been told by the state, anywhere those children facilitate in that school for the preschool age, if it's licensed, that's going to have to probably be looked at. So, so if that chapel is being used, it's probably going to be looked at. If a music room is being used, that's probably going to be looked at. If it's hallways that the kids go through, that's going to be looked at. So just make sure that you guys are aware of that. So the next thing we want to talk about is bulk food and bulk beverages. So bulk milk, that is anything like that's half gallon, gallon milks. They cannot be stored in dorm refrigerators anymore. They have to be stored in a full-size refrigerator, and it needs to be stored in the kitchen. Any bulk dry foods cannot be stored in a classroom that there is not a designated food preparation area. A lot of people ask, what is the food preparation area? A food preparation area consists of a countertop that is clean and in good repair. It has a separate hand washing sink, and it has a refrigerator sometimes if it's necessary. So you would have to have those things in order to be able to keep bulk dry foods like goldfish, cookies, crackers in your classroom. Otherwise, you have to have individually packaged snacks like individual potato chips, individual goldfish in those classrooms. Now, that does not mean you cannot serve those things. Bulk food can be served in a classroom, but once it's served, you have to take it back to the kitchen when it's finished being used. Um, I've had questions as to what is service and what is portioning, like service or prepping. I've had that question. Serving and portioning is basically taking food and putting it onto a plate, or pouring it into a bowl, or putting it onto a napkin. Prepping means you wash, you're cutting, you're cooking your food. So, for example, cutting an apple is considered preparation, it's not considered service. So, you need to have those apples cut in the kitchen or those oranges cut in the kitchen and then bring it to your classroom, unless you have that food preparation area. Let me make sure I'm not missing anything else here. So if you're pouring cereal onto a plate or a bowl, that is considered service. So y'all can still do that. Another thing that has been put into the rules is specialty milks. Specialty milk means almond milk, rice milk, soy milk, those kinds of things. So this part is a little different. If you bring it from home, if a parent is supplying that to the center, it has to come in unopened to the center at the beginning of each week. It needs to be labeled with the date that it comes in and the child's name, and it needs to be sent home at the end of the week, even if it's unopened or partially used. So it cannot come back to the center. So you have to make sure that they're bringing a brand new bottle or container each week. Now, if your center is providing those milks, that does not apply to you. So we've had some people to say they're just going to start supplying their own milk, for those children. But if it does come in by the parent, you have to follow those labeling instructions. It has to be stored in the kitchen in the big refrigerator. Let's see. I think that's all on that. So the next thing that's changed a little bit is kitchen staff and food prep. Just a little bit, not much, but you are now required to wear gloves, use utensils or deli paper when you're preparing ready to eat food. You cannot have any bare hand contact. What is ready to eat food? I get that question a lot. Ready to eat food is food that does not need a cooking step and it can be eaten as is. So, example, lettuces, crackers, apples, deli meat, cheese, hot dogs. Those are considered ready to eat. So before you put those gloves on, you need to make sure that you're washing your hands, and you need to make sure that the gloves are being changed between different tasks. So what that means is if something has fallen on the floor and you pick it up, you need to take those gloves off and change those gloves and wash your hands first. If you are touching raw meat and then you need to make a salad or make or cut up some cheese to put on a plate, you need to take those gloves off, wash your hands, and put a new set of gloves on before you guys are touching the ready to eat food. So gloves need to be worn if kitchen staff also has any artificial fingernails or painted fingernails. So that is also new. You have to wear gloves if you have any of those things. Another kind of like it's not a pet peeve, but it is kind of a pet peeve, I guess, is if you aren't touching food or handling food, you really don't need to be wearing gloves, because we see people make mistakes with that on that for that instance. So everybody doing everything with the same set of gloves is not a good thing. So you don't need to have gloves on when you're washing dishes. You don't need to wear gloves when you're opening a refrigerator. Just that kind of stuff. So if you're handling a container that food's in, you don't have to wear gloves. It's just when you're touching the food itself. So just make sure people know that. Now, the next thing is food temperature changes. The only thing that's changed under here is any food that's being heated in a microwave has to be heated to 165 now. The hot holding rule also has changed a little bit. So food that's going to be held hot has to be held hot at a minimum of 135. In the past, it was 140. Now it's 135. So that's stuff that if you're gonna keep it on the stove, holding hot, or if you're gonna have it in a steam well or a steam table, it has to be a minimum of 135 now, not 140. The next thing you have to have is a thin diameter probe thermometer, and it has to be digital. Most of them are. I have not seen a thin diameter probe thermometer that is not digital. So what we talk about thin diameter probe, if you look on that bottom picture on the left, that is what a thin diameter probe looks like. We have given most centers one of these already. I think I have 2 centers that I have not given mine one to yet. And I'll be giving those out as soon as I get to you guys. So just make sure you keep that thermometer and use that thermometer. That is what it's there for. So make sure you're using your thermometers to check that food temperature. The next thing that we got to talk about is bottle warmers and feeding of bottles. Bottle warmers has to be filled using water that comes from a food prep sink, not a hand sink. It can't be a food prep hand sink or a regular hand sink or a diaper changing sink. It has to come from a sink that is specifically made to make food. So you can bring that from a kitchen. You can use bottled water. There are options, or you can go ahead and have that food come in prepared, or the water come in prepared from home by the child's family. You just can't get it from a hand sink. That's new. Another thing that we get asked a lot, and they specifically put into the rules now, is that there is a no 1 hour rule when feeding a child. It's never been there. Feeding is considered completed once the child is removed from the feeding area and they start a new activity. So if you lay them down on the floor, that is considered done. Burping a child is not considered complete. Burping a child is part of feeding. So if you're sitting there burping a kid, that is not done. You can continue feeding a child that way. But if you lay them down or you put them in another area, that is considered done. So you cannot save that formula or that breast milk for 1 hour after the feeding. That is not a thing. That's breast milk or human milk is what they want to say now, or formula. And milk cannot go back into the refrigerator once it's been in that child's mouth. It has to go either be sent home or discarded. So you can put that back into the cubby or a diaper bag to go home with the family at the end of the day. The state has recommended that you guys or have parents bring smaller portions of milk. So instead of 4 ounces of milk, if you know that child's not going to drink 4 ounces of milk at a time, maybe bring 2 ounces of milk. Or if instead of 6 to 8 ounces, or if it's a 4 ounce bottle and you know they're not going to drink that 4 ounce bottle, bring 2 ounce bottles. That way that you don't have as much waste. Now, if this is where people I think get confused, but if the feeding process has not started at all, and you've heated that bottle or warmed that bottle up, this is a recommendation that the bottle can be served within an hour. So if you've heated it up, it's not been in the child's mouth at all, it can be used within an hour. But once it goes into that kid's mouth, the feeding is started and you cannot use that milk anymore. It's done once you sit that child down. So I know that can be confusing, but it's before starting. That's where the hour comes in, but that's a recommendation. That is not set in stone, but it's a recommendation. I know we do have some centers that do family style service. Once that food is served and put out on the table for family style, it cannot be served for another meal. That includes milk. So if you guys are using gallons of milk and you sit that on the table, or you put it in ice on a table and the kids serve that, or they're serving themselves, that is considered served. You cannot reuse that. So they're recommending that you use smaller pitchers of milk instead of gallons of milk. And once that's put on that table, it's considered served. You cannot use it again. And so you have to discard that. I have seen in the past where people put a whole gallon of milk on the table and the teachers may serve it, but it's been sitting out through the whole entire serving process, that's considered served. You cannot use that milk anymore. So we recommend you guys use smaller pitchers of milk if you're going to do something like that, or just put it straight back into the refrigerator after you pour that milk. So just make sure y'all understand that. Another thing that we see are high chair trays, and this is also in the rules. High chair trays have to go to the kitchen to be washed, rinsed, and sanitized. It cannot be cleaned in the classroom. You can't spray it down in a classroom. So if you have trouble getting that stuff to the kitchen to be washed, rinsed, and sanitized, you can just buy extra trays. So you can just purchase the tray part. So, and then you can just sit it outside the classroom, have somebody come and pick it up if you're having trouble getting those cleaned. So just have extra ones. But they do have to go to the kitchen to be washed, rinsed, and sanitized. Another thing that's new is sanitizer and disinfectant when you have to change that out. So if you're using chlorine sanitizer, it has to be changed out every 24 hours. I've gotten questions about when in the 24-hour period. I would suggest doing it at the same time each day. So if you make sanitizer in the morning, do it every single morning. If you do it at nap time, just do it at the nap times. Or if you do it at the end of the day, do it at the end of the day. Keep it consistent. If you're using quaternary ammonia, that is a little different. It specifically says chlorine in the rules. So if you're using quaternary ammonia, you have to change that out according to the manufacturer's instructions. You need to be testing that every day to make sure that that strength is correct, because it does go out, what you said, about 4 days on average?
More or less, yes.
So just check that strength. So just, you can use quaternary ammonia, but you need to follow those manufacturer's instructions when you do so. Another thing are potty chairs. If you are using potty chairs, like the one on the left there, it has to be stored in a toilet room with a spray rinse toilet, or you have to have a utility sink. You can't just spray it down with disinfectant or dump it in the potty in the toilet. You have to have that spray rinse sink or a spray rinse toilet or a utility sink. So we recommend the seat on the right side over there. This is what's approved to be used in a bathroom without having to have that utility sink or the spray rinse toilet. So just make sure that you guys are following those. Another thing that's different is the designated sick space. And this is something that we have been told by the state that we have to start doing. So if you guys are using an office as a sick room, anything in that office that has to be locked up needs to be locked up. This is whether that space is licensed or not, because we will have to look at this now, because we have to make sure that whiteout's locked up, and anything that would have to be locked up is locked up, because kids are in that space. They can access that stuff. So if you do not want us rummaging through your office, you may want to consider finding a different location for a sick space. If you're not concerned with us looking around, then you can keep them there, but that is new. Another thing that is new and you have to have is a vomit and diarrhea cleanup plan. This one here is the poster that they supplied for us, but there is a 4-page document that you also are required to have in addition to this poster. If you need this, you need to let us know and we can get you a copy. I know that Cindy sent out a few emails with this in there. So if you need it, just let us know and we can get that for you. We've had a lot of questions about what you need for those cleanup kits. So it's not difficult. So you can buy some kits already put together, or you can just get the stuff and make one yourself. I would just recommend making it yourself. So you have to have disposable gloves. You have to have some kind of apron, a disposable mask, shoe covers, hair covering, paper towels, garbage bags. The garbage bags can be tied, or they have to have like a something to tie it up with, some kind of scoop, a mop and a bucket, soapy water, a disinfectant. It could be your disinfectant. It does not have to be, it could be an EPA disinfectant as well, but it can be your disinfectant. So the 5 to 800 is perfect for that. And then you need some kind of absorbent powder or kitty litter. And a lot of people have just been storing it in that bot bucket, so it's all together. Now, we do have to see that you have the policy and the kit during an inspection. You need to be able to show us that you have that put together. There are a few things that the policy recommends. They do recommend having a bucket with a disposable mop head, and then, or a mop with a disposable mop head and caution tape, but that's not necessary as long as you can keep kids away from the area. But what is needed is what's listed on that slide. So make sure you have those things. And so those right there are the big topics when it comes to rule changes. There are a few things that we want to discuss with you that we're seeing on inspections. I don't know what's going on right now, but we have had a lot of re-inspections this past 6 months. This half of the year. Just about, about 75% of the centers we've had to come back on for something. And we want to kind of go over these things with you, what we're seeing in these centers that we're having to come back on. Because we don't want to have to come back, and I know you don't want to see us more than you have to. So just try to make sure that you guys are taking care of things on the inspection report that are 6s. Anything that is a 6, we have to come back on and do a re-inspection for. So the first thing that we're seeing is your kitchen. Kitchens have to remain inaccessible if it's unoccupied. So if there's nobody in that kitchen, you have to have that kitchen inaccessible. I cannot tell you what inaccessible is. You need to talk to the Department of Insurance on what that consists of. Some things that we have suggested is having a half door with a self-locking mechanism. You just reach over and open the door from the inside. That one might be considered inaccessible. But I'm not allowed to tell you what's inaccessible. You have to make that determination yourself. We have been told by the state to contact the Department of Insurance on figuring out what is considered inaccessible. But it cannot be accessible to children if there's nobody in that kitchen. Another thing that you have to have is a separate lock space in the kitchen. That can be a locked cabinet, a locked box, a locked closet. It has to be a specific separate locked space in that kitchen. I know that a lot of people lock the kitchen, but that is not considered locked space. So make sure that you are making sure that you have that locked space in there. Okay, what is approved locks? We get this question often. An approved lock is like a padlock with a key, or a combination lock, like the second one. A cabinet with a lock, a magnetic lock, the biometric lock that you can use with your fingerprint or an eye or whatever. The number lock that's mechanical. So those are considered approved locks. Anything that is similar to those you can use as an approved lock. What is unapproved? And this is for your locked space. So like locked spaces in classrooms. So those locks before are what you need to have for your locked storage. So anything that was required locking needs to be under lock and key or one of those other locks. These are considered unapproved locks. These you cannot keep any type of chemical behind. You cannot keep anything that requires locking behind this. Now you might ask me, why is there a key there if it's got a key? Well, you can't leave the key in the lock. If you leave the key in the lock, that's considered accessible to the child because they can unlock that key. You would not believe it, but kids are pretty smart and they can figure out these locks a lot easier than I can sometimes. I think Andrea was telling me, or somebody was telling me, some kid used a dinosaur tail and was able to unlock one of these.
It was me.
Yeah, unlock one of these cabinets. So they're pretty ingenuitive there. So just make sure that people are knowing what locks are approved and what locks are not approved for certain things. Something that we're noticing is diaper changing procedures are being done incorrectly. I'm just gonna hit the highlights of this. I know most people think they know diaper changing, and you got new people that may not understand diaper changing. So you're supposed to have some kind of diaper changing procedure on the wall near the diaper changing area. I recommend following that procedure because I mean it's there. It's there for you to read. Look, stop and look at it. Don't take it for granted that you know it because sometimes you get in a hurry or we're there watching you and makes you nervous. And I get that because I get nervous when the state comes and watches me. So just make sure that you're following those procedures. So what we're seeing that's being done wrong. The first thing is making sure that once you remove that soiled diaper, you take a clean wipe and wipe the child's hands, and you take a clean wipe and wipe your hands. So you have to have that wiped hands in between the dirty and clean diaper. So once you take that dirty diaper off, make sure you're wiping the child's hands and your hands with a wipe. The next misstep that we're seeing is once you're done with the diaper changing method, make sure you're washing that child's hands. So if a child can hold their head up, they have to have their hands washed in a sink. If they cannot hold their head up, your poster has one thing on there which says you can use a drop of liquid soap on a damp paper towel and wipe the child's hands. That's the wash part. You can take a wet paper towel and get the soap off, and then you can dry the child's hands with the third paper towel. That's what your poster says. But our rules say you just have to wipe the child's hands with a wipe. So if the child cannot hold their head up, you can wipe it with a wipe. If they can go to the sink or they can hold their head up, you have to wash their hands at a sink. The next step that we're seeing is when you're cleaning, you have to clean and disinfect the changing table, meaning you have to have a detergent solution. That's soapy water. You need to spray that on first and then wipe it down, wipe it off with a disposable towel. And then you spray the disinfectant that's between 5 and 800 bleach or your quaternary ammonium solution. And you need to leave that on there for 2 minutes for chlorine. And if it's quaternary ammonium, you need to make sure you're leaving it on there for the manufacturer's instructions. We have seen recently people are just spraying disinfectant on the table. If you're just doing that, that is a 6 demerit item because you're not actually cleaning and disinfecting those tables. You have to clean the table first with soapy water and then use a disinfectant to to disinfect the tables. And then the last thing, make sure you're washing your own hands or have your staff wash their hands. Make sure that once you finish cleaning and disinfecting that table, you go and wash your hands and follow the proper method, which leads into the next part. We've been asked a lot about stand-up diaper changing. I don't know why. Did I go? Or did I completely miss one? Oh, yeah. So the diaper changing, stand-up diaper changing. So our rules do not address stand-up diaper changing. So there was a question about what is considered what's the word? A barrier between the floor, a non-absorbent barrier. Thank you. I was like, well, I was trying to think of what the question was exactly. The non-absorbent barrier is there if you're laying a child down on the floor to change their pull-up or diaper. If you are doing it standing up, you technically don't need the non-absorbent paper or barrier. You just need to make sure you're following the proper cleaning and disinfecting of the floors or the area any of that stuff touches. and then making sure you're following hand washing procedures. Our rules do not address the stand-up diaper changing.
Kristen, emphasize cleaning, and disinfecting only if something touches the floor, like, yeah.
So if something touches the floor,
Yeah.
like a dirty diaper falls and touches the floor, that's when you need to make sure you're cleaning and disinfecting those surfaces. So we have had people ask, what should we use for that impermeable surface? We recommend a mat. I don't know of any paper that's considered non-absorbent. I called the state and asked the state if they knew of a non-absorbent medical paper, and she was like, I have no idea what they're talking about. So with that being said, if you're going to use a mat, you need to make sure that the mat is easy to clean on both sides. You need to make sure that it's stored off the floor and away from children. You also need to label the sides of the mat. One side needs to be labeled floor side, one needs to be labeled changing side. And the floor side is always on the floor. You don't put the changing side on the floor ever. So that's why you need to label your mat on to which is which. If you're having to lay a child down to change a diaper, or if they have a poopy diaper for that matter, you need to really take them to a changing table. They do make changing tables that have stairs. I've seen those in some centers. So you can get, or you can have a step stool or step ladder that's just for changing. You just move it out of the way once the changing's finished. If they're concerned, there's probably concerns for safety there. But if you're having to change a poopy diaper or lay a kid down, it is highly recommended to go ahead and just take them to a changing table to do that. Even if you have to take them to a different room that has a changing table. So just understand that. I know we just recommend following the guide if you're going to do a stand-up change that they gave out at the beginning of the year. I believe Cindy sent that out earlier this year sometime. And so just follow that. But as I said, our rules do not address stand-up diaper changing. The next thing that we're seeing is improper hand washing. So make sure all your staff and the kids are following the proper hand washing methods. As I said before, if a kid can't hold their head up, you need to wipe them with a wipe or the 3-step paper towel method. But if they can't hold their head up, you still have to follow the proper hand washing methods. Something that we've seen recently, I don't know why I clicked that. That wasn't supposed to be clicked yet, but is when a child is going to the bathroom by themselves, you know, they need to make sure that somebody is actually watching those children. Because they need to make sure that that kids are washing their hands when they leave the bathroom. They need to make sure that they're actually putting soap on their hands. They need to make sure they're actually scrubbing their hands for the correct amount of time. And they need to make sure that kids are drying their hands first with a paper towel, then turning the water off. What we're seeing is kids are going to the bathroom by themselves. The teachers, unfortunately, are not paying attention, and kids just walk out without washing their hands at all. So when teachers are watching the children, I'm not saying that it's perfect every time, but they're more likely to do it correctly because you're able to supervise them how to wash hands properly. Because if you're not paying attention to those kids and not watching them wash their hands, they're more than likely not going to wash their hands, or if they are, they're doing it wrong. So the number one misstep that we're seeing is they're not washing for the correct length of time. So it has to be at least 10 to 15 seconds. I think on here it says 15 seconds is required, 20 is recommended. That's scrubbing with soap. And then they need to rinse their hands. And the next missed step is turning water off with their bare hands. You can't do that. So basically, if they're doing that, they're just basically recontaminating their hands all over again. So they need to grab a paper towel, dry hands first, and then take the towel and turn it off. If you're doing like a line of children washing their hands at one time, this is something I recommend for everybody. Tell the kids not to turn the water off. Have the teacher do it at the very, very end. That way, the kids are not tempted to touch the faucet handle when they're washing hands. So if they're doing it by themselves, if they have to go to the bathroom, yeah, you need to teach them how to do that. But if you're doing a line of kids at one time, then I would highly recommend just leaving the water on through the whole hand washing process for every single kid. And then at the very end, have either the last child turn the water off with a paper towel or have the teacher do that. It would make life a whole lot easier. And then just make sure your staff and your teachers are following that same method. Anything you want to add on that? Okay. Let's see. The next thing I want to talk to you guys about is what has to be locked up and what does not have to be locked up. So if you look at your labels will tell you a whole lot. So if your label says keep out of reach of children, and there's some kind of disclaimer such as do not swallow, poison if it's ingested, eye irritant, skin irritant, do not breathe fumes, corrosive, wear gloves for prolonged contact, etc. Those things have to be locked up. So normally your label will say keep out of reach of children, and it'll have those disclaimers on the back. So these are some examples of things that have to be locked up. Whiteout, liquid whiteout has to be locked up. We've been seeing a lot of liquid whiteout out. Another thing we're seeing out is Lysol spray. Lysol spray has to be locked up. This time of year, the snow has to be locked up. And a lot of it, like the aerosol snow, anything aerosolized, like Lysol spray, the liquid, the duster, spray off duster stuff, aerosolized sunscreen, all of that stuff has to be locked up. Now, rescue medicines. A lot of people get confused as what is rescue medicine. Rescue medicine is like inhalers and EpiPens. It does not include Tylenol. It does not include Benadryl. A lot of people think that Benadryl is a rescue medicine. It's not. I know that's the first line of defense with somebody that has an allergy, because I know I worked in an allergy clinic for years. That's the first thing they tell you to give kids that have an allergy, but it's not considered a rescue medicine. So rescue medicines are only medicines that are like an inhaler or an EpiPen or an AVQ, which is another type of injectable EpiPen. Another question that I get asked is about diaper cream. Diaper cream that is prescription diaper cream has to be locked up. Another thing that we see out a lot of times is the diffusers, what do you call it? Essential oils. Essential oils cannot be left out. They have to be locked up. So if you think about those kind of things, those all have to be under lock and key. Something that people don't think about is batteries. Batteries, if ingested, all kinds, is dangerous to kids. So you really need to keep batteries locked up. I actually pulled up a label of a battery in the MSDS sheets on batteries. So your button batteries, they have the label that states, swallowing can lead to chemical burns, perforation of soft tissue, and death. Severe burns can occur within 2 hours of ingestion. That's for the button batteries. Now, you're like, AAA, AA, what's the problem with those? Well, if you look at the actual MSDS sheet, and if you look at the back of some of those batteries, it actually states that if swallowed, you have to consult a physician at once because it may explode or leak and can cause burns or injuries. The MSDS sheet says that swallowing a battery can be harmful. Contents of an open battery can cause serious chemical burns of mouth, esophagus, and gastrointestinal tract. It can cause respiratory irritation. If contact with skin, it can cause skin irritation or chemical burns. If contact with eyes, can cause severe irritation and chemical burns. So do not leave batteries out. Don't leave it in a drawer. Don't leave it on your desk. Yes, I know there are toys that require batteries, but most of those have a screw on the back. So keep your batteries locked. We've been seeing a lot of unlocked batteries lately. Now, what's out of reach? Or inaccessible for that matter. You need to read your labels. Your labels will tell you this too. So if it just says keep out of reach of children and there's no other disclaimer like we talked about before, that has to be inaccessible, or out of reach. Out of reach means 5 feet up. Inaccessible can be behind a child-proof lock. It doesn't have to be under lock and key, but it has to be inaccessible. So, check your pocketbooks and your backpacks as well. If there's medication or chemicals like eye drops, Tylenol, ibuprofen, cough drops, screen cleaner, eyeglasses cleaner, etc., those need to be locked up. If you don't have that kind of stuff in your pocketbook, it just got to be out of reach. If we see a pocketbook down on the floor somewhere, we may ask you guys to open that up and let us see what's inside. I'm not going to go and rummage through it, but I'm going to ask you if I can see what's in there just to make sure that there's nothing in your purses or pocketbooks that is hazardous. But you definitely need to make sure that you're not keeping stuff in your pocketbook that is dangerous to kids and left down. Another thing that I keep getting asked a lot is about hand lotion. Some hand lotions do have disclaimers on the back, but it has been allowed in the past that hand lotion can be out of reach. Just keep it 5 feet up or behind a childproof lock. Non-prescription diaper cream has to be out of reach. It can't be in a drawer that kids can access. It has to be out of reach of a child, but it's non-prescription. As I said before, prescription has to be locked up. Another thing that we get asked a lot is about hand sanitizer. Big, huge containers of hand sanitizer has to be locked. But if you have an individual small container, I think it's like 8 ounces or less, you can keep that 5 feet out of reach. Whiteout, you can have the liquid tape whiteout, but you can't have liquid whiteout. So there are some things that you can have out of reach. And so just look at those labels. Did you say seizure medicine? Sorry.
It just,
Okay.
yeah.
Keep going.
Okay.
Don't worry about that.
So we've got a lot of questions about change of use of sinks. That's something that keeps coming up a lot. So what is change of use? The definition of change of use is using a hand washing lavatory or a sink for purposes other than its original intent. So what that means, if you have a hand washing sink and you need to clean toys, you have to clean and disinfect the sink before you wash your toys. If it's a hand washing sink and you need to wash toothbrushes or rinse your toothbrush, that would be considered a change of use. So you're taking it from a hand washing sink and you're going to be washing toothbrushes. That would mean you would need to disinfect or clean and disinfect, meaning soapy water, clean it, and then disinfect it. If you're taking a hand washing sink to clean paintbrushes or craft supplies, that would be required a change of use. If you're taking a hand sink and you're going to make it to a diaper changing sink, that is considered change of use. Or vice versa, if you're taking a diaper changing sink to make it a hand washing sink, a regular hand washing sink, that would be considered change of use. What we have said, if you're in doubt of if it needs cleaning or not, just go ahead and clean and disinfect it. And you have to use soapy water first to clean it and then use disinfectant. And according to the rules, it has to be done between change of use or as needed or at least daily. So here's some scenarios or some commonly asked questions that we get. So the first one, if a room has one general classroom hand sink, can it be used to fill water bottles, sippy cups, make formula, wash, or rinse bottles or sippy cups? The answer is no. That is considered a hand washing sink. And it cannot be used for for consumption of drinking or to wash dishes. Another question that we get is, if a room has a food preparation hand sink in a food prep area, can that sink be used to fill up water bottles, sippy cups, make formula, wash, or rinse bottles? And the answer is no. That is still considered a hand washing sink. You cannot use that water to drink. You can't use it to fill up a water bottle. You cannot use that water to fill up a bottle warmer. It's just for hand washing. Another question we get asked, if a room has multiple general classroom sinks, can one of those sinks be designated and labeled to be used to fill up water bottles, sippy cups, make formulas, wash or rinse bottles or sippy cups? The answer is no, because they are considered hand sinks as well. You still can't use that for drinking water or washing dishes. So if a classroom has a food preparation area that includes a hand washing sink and then it has an additional sink in that area, can that be used to fill water bottles, sippy cups, formula, wash and rinse cups? The answer to that one is actually yes. So if you add a sink to that area, so you have one sink that's a hand sink and one sink that's going to be used for food preparation, not hand washing, but just food preparation, then you can fill up water bottles, sippy cups, formula. You can dump milk, but you cannot wash dishes. That's the little caveat there. You can take that stuff to the kitchen to wash. So if you have, it has to be labeled as a food preparation sink. It cannot be labeled as anything else. No hand sink at all. So those are some questions that we get asked quite often. With that being said, that's kind of like the question that what we've been seeing and what we're marking quite often. Now we want to be able to answer the questions that you guys have. So,
yeah, and I've got some if you want to.
Okay, so Andrea is going to give me the questions and we're going to try to address those for you.
I'm still watching. Okay. First question, I'll let you read it. Will the PowerPoint presentation be shared?
So the PowerPoint presentation is going to be shared afterwards.
Read the question and then, yeah, if you can.
Yeah. So the question is, will the PowerPoint presentation be shared afterwards? And the answer is yes. We're going to have that available to everybody afterwards. I think my supervisor was saying that we're going to try to put that on the county website. I don't know how long that's going to take to do that, but we can send that out to you. So the next question.
Literally how they were written.
What about food that would be used for crafts or activity time? Does it need to be labeled crafts only? I would say yes. I would say yes. The answer would be yes. That way we know specifically that it is for crafts. If we don't know that, we're going to say it has to go to the kitchen. So you need to label that as crafts. The next question I have is, if the cook is in the kitchen, is the door allowed to be propped open? If there's somebody in the kitchen, yes. It can be left open. But once that person leaves the kitchen, then it has to be inaccessible in some form or fashion.
This next one is specific to Kids of Hope, and I'm not clear exactly on the question. So since you inspect, maybe you understand the question better than I do. That's literally how it was phrased.
So this question is specifically for one center. I think Kids of Hope asked this question. It says, my kids have a bathroom with a sink and a bathroom without a sink. So we have a potty diaper changing sink. That's the sink my kids use. Is that okay? As long as there is a place for them to wash their hands.
You know the situation, and you may have to look at the situation.
I would have to, I can't remember. I mean, it was set up that way before I started. So I would have to look at it when I go.
We can answer that specifically. Okay.
Okay, so I'll come back to that question. What about if we use our office as a sick room? If we have a tool drawer, does that need to be locked up? I'm sorry.
That's all right.
So tools, if it's like a saw or something in there, I would say, yeah, it would need to be locked up. But if it's like a screwdriver or a hammer, it doesn't, there's nothing on our rules.
It is, but I would say yes, I would lock it up just for safety.
I would, as she said, just lock it up for safety. So yeah. Are MSDS sheets required for batteries? No, it's not required for batteries. I just pulled that so I could explain to you why they needed to be locked up. What about seizure medication? That could be out of reach. So I think seizure medicine is considered a rescue medicine.
Can you read that writing?
The next question says, you said essential oils have to be locked up. Does that mean you can have a diffuser with essential oil? That answer is no. I think that's more of a Mona thing, from what I've been told. But it's essential oils period is not safe for,
No.
well, because the essential oil has to be locked up, so. How will the food rules affect the food activities? So as I said, it depends on what kind of activities you're talking about.
She said make up individual cookies, cutting apples, peeling their own oranges.
Our rules don't really address
If they're
that.
supervised, to me, it would be fine. That supervised, they wash their hands, so yes, they could continue to do those activities, yes. I'm sorry.
Were you able to hear? I don't know if you were able to hear Andrea, but
I'm sorry, I'm kind of hoarse still.
she said that if the kids are supervised, you guys could still kind of do the cookies activity with them or cutting an apple as long as they're supervised. And it's for their own consumption. They're not like cutting an apple for other kids. And then maybe if they're wearing gloves or something like that, you could do that. But you would have to make sure they're being supervised and they're washing their hands and following proper procedures.
And they're eating their own stuff.
Yeah, and they're eating their own stuff.
Can they peel their own oranges?
Yes.
Yeah, kids can peel their own oranges. They're allowed to do that. As long as hands are being cleaned, they can peel their own oranges. With cleaning, I understand the use of detergent solution and disinfectant. Is sanitizer still part of cleaning or is it just 2 steps?
I think I know what they're talking about. I don't know if you can all hear me. I think what was meant by that question, Randolph County always had the 3-step. We always encouraged the rinse after the cleaning step. Sanitizer is not involved in diaper changing at all anymore. It is strictly disinfectant. So it is, if you're still doing the 3 steps with the rinse, that's great. If you're not, if you're only using detergent and then disinfecting, that is fine too. There was never anything in the rules that said you had to rinse, but we always encouraged rinsing. I hope that answers that question. I have another one too.
Okay, I'll get that. There was one that was missed. It said, so feeding has to be finished in one sitting and cannot be kept after child has stopped drinking. So if the kid is still sitting in your lap and they're burping or you give them a second to take a little breather, what that means is if you put them down onto a floor or into a crib or to a play area, that is when feeding is stopped. So you can't pick them back up and reuse that milk for another sit down, like another feeding. So once you put them down, period, it's done. I guess.
Yeah, that's
is that right?
Once they return.
Yeah, once they leave the feeding area.
Yes, it's done.
I mean, I guess if they had a terrible diaper and you needed to go change their diaper, that would be different, but pretty much they would be feeding.
Sorry, I'm reading the questions.
I think that was the only
That's
one.
it. That was
Okay.
the only extra one. Are there any more
Is that what you
questions?
had?
Yeah, that was it. That was it.
Okay. Is there any other questions that you guys may have for us?
And they're welcome to either email any of us with questions, call us with questions. We will be glad to answer.
And we actually encourage you guys to call us with questions.
We've got our information up there.
I've got our phone numbers up there. Our email addresses are up there. Call us anytime you guys have questions. I would much rather you call me and then we discuss the situation or, answer your questions before you walk into a center and then find a situation that we shouldn't be finding. So I would much rather you ask those questions beforehand and call us anytime. We'd be more than happy to answer those questions.
Tell them that the recording will be shared so it can be shared with the principal. That
Yes.
was a question.
So yes, the recording is going to be shared so you can share it with the principal of the school. So that is fine. We'll do that too.
We also, we see less provisionals, guys. We love you guys, but we don't want to keep coming back. I know you don't want to keep seeing our lovely faces over and over too.
I mean, we've seen a lot of provisionals lately, a whole lot.
I'm not seeing, we can wait a few minutes. I'm not seeing any more questions.
And remind them that sometimes the rules might be a little bit different for the rating scale.
Oh yeah. So For the rating scales, now the rules may be a little bit different for those. I'm not as familiar with the rating scale situation, or the questions that, they may ask you for rating scale. But they, according to what Cindy was just telling me, that rating scales do sometimes have, a little bit different rules for that. And if I'm not mistaken, you said they were a little more
Yeah,
stringent most of the
they will
time.
exceed.
So they'll actually exceed what we require. So if you're doing what the rating scale requires, you're gonna meet a lot of times what we require. So those are some things that you need to think about too. Anything else you can think of, Cindy?
Another question just popped up.
You just read it out.
Oh no. There was a question that just came in. It says, oh
You
no,
went up too
I
far.
went too far. Hold on.
One more.
I can't get it to stop.
Okay.
So as long as we're able to keep other children away from the area that has vomit, the cones and the caution tape aren't necessary. No, it's not necessary. As long as you keep those children away from that area, either by having another teacher or moving them off out to a different area, or keeping them away from that area, you do not have to have the caution tape or the cones. It's just a recommendation. So we talked about the tools already. The tools need to be locked up for safety reasons. So yes.
No, at the bottom, I don't see.
So make sure that you are locking those tools up.
That's so far, let's see it.
Any other questions that you may have? As I said, we want to use this time to answer y'all's questions, because I know some of the stuff is different. There are different things that we've discussed. Did what I talk about make any sense? Do we have any questions about what we discussed earlier in the presentation? I just want to give a few minutes for people to be able to ask those questions.
Yes.
Well, if you guys don't have any other questions for us, we will adjourn the meeting for tonight. As I said, we will send out a question and answer documentation with all of the questions that you guys have asked. The questions about change of use on sinks.
Tell them if there are more after this, we'll try to include those also.
And if you guys have other questions that you don't feel
Think of
comfortable,
later, yeah, we'll include them.
if you don't comfortable sharing on here, you can definitely call one of us and we'll write those questions down and we'll actually include those as well. During that during the question and answer that we send you guys.
They need to make sure, so we can get a copy, that their names and first and last name and centers are in there.
So if you have not done so already, please put your name, your last name, first and last name, and your center name into the chat box if you've not done so already.
There's a
Can
question.
we store mats in individual bags?
So if the mat, so the question was, can we store mats in individual bags? The bags would have to be cleanable. They need to be able to,
They need to be labeled.
they need to be labeled with the mat number, and so the mat and the bag needs to correspond. You need to make sure that the cots are stored in the same way each time. So if it folds, the floor side is always going to be on the outside, and that's the part that touches the bag. The part that the kid lays on never touches the outside of the bag. And they need to be able to be cleaned regularly.
I didn't get that.
Sorry, we're trying to go back up. It's
They
taking
want you to go back to feeding the child.
What was the question
I
exactly?
don't, did you get
How
it?
strict is the baby feeding stopping? Like if you had to go get if you had to go get something or help a parent with picking up a different child, could you go back to feeding that child? Or is that a hard no? I guess you get interrupted.
So the question basically said is I'm gonna sum it up because we can't get it pulled up right
It
here.
says how strict.
How strict
is the baby feeding?
is the baby
stopping?
feeding stopping?
If you had to go get something.
If you had to go get
Or
something
help a parent.
or help a parent
Picking up a different child.
picking up a different child, could you go back to the feeding? So basically, if you're taking that child out of the feeding area and putting that child down at all to go pick up another kid or to help another parent get the child out, another child, that would mean the feeding is over because you've put the child down. So that would need to be starting a new bottle or you'd be done with that bottle. So the answer would be no on that. Is there any other questions on this? She's writing that question down. Did that make sense? I hope that makes sense.
Go ahead and look, I got it.
I'm sorry.
No, you're good, go ahead. Is there any more?
No. Just
Okay.
making sure there was no exceptions.
Okay.
And unfortunately, there's really not that many exceptions when it comes to the feeding stopping situation. We were just told that by the state is once that child leaves that feeding area, but by any means, meaning you put them down, put them away, like, they're gone out of that feeding area, it's done. And unfortunately, there's no exceptions at all on that. Any other questions that you may have?
I think I'm just signing in. You said we can get a copy of the chat? Okay, cool.
So if there's no further questions, we're gonna go ahead and, white outtake 5 feet up.
5 feet.
If it's the tape itself, you can have that out. There's nothing saying it has to be 5 feet up. The whiteout tape can be left out. It's just the whiteout liquid that cannot be left out. It has to be locked up.
If the child's clothes are dirty, do they now have to be in a container?
There's nothing in our rules that state. So the question was, if the child's clothes are dirty, do they now have to be in a container? There's nothing in our rules that state they have to be in a container. I would just recommend a bag or something to put them in. That's just a recommendation.
What if it's poopy?
Now, if it's a poopy diaper, then I would definitely have something different to put them in and separate it out for sure.
Like it's sure it's like tight.
Like a tight closing bag. Yeah. So if it's like pee or poo clothes, then I would definitely have something to put them in other than their bag because you don't want to contaminate anything else. But it doesn't have to be like in a container per se. It can be in like a bag.
She's specifying poop and pee clothes, so yeah, tight.
Tight bag. You could just, as long as it's closable.
Keep it away from the clean stuff.
Yeah, just keep it away from clean. So just have consider a secondary place for it if you want to. Anything else? So the question is, what happens if the teacher have to go to the bathroom and she was feeding the child? Does that mean the feeding is over? That would be yes, because the child is no longer in the feeding area.
Get another teacher to continue it.
You can get another teacher to continue that feeding. But if you put that child down, it's over. You can't restart that. Any other questions? I know a lot of people have questions on the feeding. We understand that. Because there's a lot of things that could happen.
I want to throw in real quick that I was asked at one center if they were burping the baby and they needed to continue feeding. Was that considered over? No, you're still burping the baby, holding the bottle, and the child has not been put down. So yes, you can burp the baby and continue to feed the child. I hope that clarifies it. That was asked at one of my centers during an inspection.
And I was asked to, can kids help with a stand-up diaper changing procedure? Can they help take their diaper off? Can like pull up off? As I said earlier, our rules really don't address the stand-up diaper changing procedure. I mean, if you want to teach them how to do things, just make sure they're following proper hand washing methods and stuff, and make sure teachers are supervising those children. And the teachers are helping them do that, because you don't want to contaminate a lot of stuff in the process of them helping you.
I appreciate everybody who showed up tonight. I know you guys have had long, hard days, and I appreciate the attention you have given us, and I hope this helps everybody and that everything goes smooth in your centers, especially with all these wild children and Christmas coming. There's been some wild stuff going on lately. So, and we love you guys, and we are here to help you guys, not go out and give you provisional. So if you do think of any questions afterwards, please reach out and we will answer them and include them in this list that I've created. So you may not think of it now, and we sign off and say, oh, I wish I would have asked that. Please, please either call or email us. We're here to help you guys.
Yep. Because I mean, I want you guys to use me as a resource. I don't want you scared of me when I walk in the door. I know our titles a lot of times scare people off. Yes, I have a job to do. Yes, I have to inspect you guys. I understand that my position can be scary, but I want you to be able to use me as a resource too, because that's what I'm here. I'm here to help you. I'm here to help make sure that your child care center is safe, in that we don't have a situation where somebody gets hurt or somebody ingests something they shouldn't ingest,
I
or
want to know where the recorded version will be.
So I just want to make sure that, you know, y'all understand that, because I don't want you scared of me when I walk in that door. There was another question about where the recording will be. I will try to send, if it's not too, I mean, I don't know how long or how much I can send on by email, but
Or send a link.
or
We'll
I
have
can
to
send you a link.
We'll have to figure that out.
I'm gonna have to figure that part out. I think my supervisor was talking about putting it on YouTube, or either putting on the website. So we are definitely gonna have it available for
County
you.
website possibly.
Yeah, the county
Okay.
website possibly. Because we were talking about trying to create a educational section on there at some point. That's our plan anyways. That's what we were told anyway. So we'll see if that actually happens or not. But we'll definitely be able to get this to you in some form or fashion.
Okay. Are there any more questions, ladies
Yes.
and gentlemen?
Lunch boxes, if they come in, do the foods have to be heated to certain temps?
Okay, hold on. Not seeing it. What was the question, Cindy? I
It
didn't.
says lunch boxes, if they come in, do the foods have to be heated to certain temps?
Lunch boxes.
Is there anything in the rules that talk about
Yes,
that?
there are, but hold on, let me find the lunch boxes.
We're gonna pull the rules up real quick to be able to answer that question.
Lunch boxes thing. I remember there was something about lunch boxes.
Can you go back to the slide of blocks that aren't allowed?
Yeah.
What tell them what they're doing.
So I'm gonna go, somebody had asked, can I go back to the locks that are not allowed? Let me see if I can go back here.
Actually, better word is approved.
So let's see here. Did I pass it? Okay, so these are the approved locks here. And so you want the ones that were not approved?
Yeah.
Okay, so the ones that are not approved, these are examples of not approved locks. The most common ones we see are the ones with that double door with that slide. I see those, and then the heart-shaped one at the bottom. Those are some of the common ones I see.
And the last
And
one,
the
because the keys.
and the last one that's not approved is because the key's in the lock. You can't leave the key in the lock. The key has to be out of reach. And I tell people all the time, I'm 5'1". If it's my height or taller, you're good to go.
Okay, lunch boxes, are they required? Okay. If you wanna read, just read. That is the rule. If you just wanna read this straight rule, it's right.
So the question about lunch boxes.
There's also another question about.
Okay. Lunch boxes, are they required to be put in the fridge if a student brings them? So I'm going to read the rule to you. Lunches, snacks, and other meals that a child brings from home to the child care center shall be labeled with the date on which the food is brought to the child care center, the name of the child to whom the food belongs to at the child's home, and shall be returned to the child's home or discarded at the end of the day. Lunches, snacks, and other meals containing potentially hazardous food shall be refrigerated at 45 degrees Fahrenheit or below and stored in the child care center kitchen or approved food preparation area. Hot foods that a child brings from home to the child care center in a double-walled insulated thermos container may be stored outside of refrigeration at the child care center with written permission of the child's parent or guardian. So to answer your question, anything that's potentially hazardous needs to go into the refrigerator that's holding 45 or below. If it's hot food and it's in a double-walled insulated thermos, that can be stored outside of the refrigerator as long as you have permission from the parent, and it has to be written permission.
Can those locks be used for non-hazard items such as construction, paper, and board games?
Okay, so the question was, could these unapproved locks here be used for construction, paper storage, and board games? The answer is yes. You can use that for non-hazardous items. So even the stuff that is considered out of reach, like hand lotion or non-prescription diaper cream or stuff like that, that does not have that secondary disclaimer, it could be behind one of those types of locks.
Am I understanding lunch boxes cannot be stored in a classroom fridge?
So if you're preparing the food, the rule actually states here, if you have, let me go back. So lunches, snacks, and other meals containing potentially hazardous food shall be stored in refrigerators at 45 degrees or below. And it can be stored in the child care center kitchen, or if you have a food preparation area. So you have to have an approved food preparation area in the classroom. So let's go back to what an approved food preparation area is. That is a counter, a hand sink, and potentially a refrigerator. Yeah. So you have to have that approved food preparation area. So, I mean, as long as you have a hand sink and the counter space, you can keep food in the refrigerator.
So it says we don't have a food prep area, so that means not stored in classrooms,
Exactly.
right?
Correct, not stored in classrooms, yeah. So if you do not have that food preparation area, you cannot store that food in the classroom.
What was the part about the letter from
So if you have there was a question about a letter from home. So if you have hot food and it's brought from home, it can be stored in a double-walled insulated thermos, and that does not have to go in the refrigerator. But you have to have permission from the parents stating it can be left out of the refrigerator, but it has to be in a double-walled insulated thermos.
What if we have a cabinet with an unapproved lock, but there is nothing unsafe for the kids in the cabinet?
So the question was, what if we have a cabinet with an unapproved lock, but there is nothing unsafe for the kids in that cabinet? That's fine. As long as there's nothing that would require locking in that cabinet, you can have those unapproved locks. But it's only, what we're seeing is people are using the unapproved locks for the stuff that would require locking. So for instance, whiteout, like liquid whiteout, or the Lysol spray, or Clorox spray paint, cleaning solutions, those kinds of things. We've seen people use those unapproved locks for those, and you can't have the unapproved locks for things that have to be that are required to be locked. Those have to be under the approved locks.
So far, we're up to date. Missing one question, but we can go back. That's good.
Can a child's parents bring a sippy cup with special milk daily, or does it have to be a full carton? It can be individual sippy cups. The question was, can a child's parent bring a sippy cup with a special milk daily, or does it have to be a full carton of milk? The answer is they can bring individual sippy cups with milk daily. It just needs to be labeled with the date it comes in and the child's name. So it can be individual sippy cups. They were just talking about the bulk, big milks, like the bulk milk, like the gallon, half gallon specialty milks that have to be coming open each week.
Can we keep lunch boxes on our counter next to the fridge with snacks as long as lunch items are labeled and refrigerated? Honeycomb does not have a food preparation area, but I would say
You just told Ramsey.
Yeah, we know.
no.
So the question was
Real similar to Ramsey.
specifically for honeycomb. Can we keep lunch boxes on the counter next to the fridge with snacks as long as the lunch items are labeled and refrigerated? The answer would be no. If you do not have that food preparation area, you cannot do that. So you would have to have that countertop with a hand sink.
Copy of this chat. I'm not keeping up with this.
Now that's only if there's hazardous.
Yeah, that's if there's only hazardous food. Like think about deli meats, cheeses, pizza, hot dogs, those kinds of things. So if it's just like applesauce or crackers or fruit, then you don't have to worry about that. But it's only hazardous items that you have to worry about.
Or some of these in school, if they could work it out with the cafeteria, I guess they could possibly store them down there. I know that may not be convenient, so we would have to work that out.
So as Andrea was saying, I don't know if you could hear her or not.
I'm sorry, I'm not. My voice is kind of.
If you're like an in-school center, you may need to talk to the cafeteria and work something out with the cafeteria about keeping the school lunches, like lunchbox in the cafeteria. And we can help talk to them about that kind of stuff since we're in those school lunchrooms as well. Because Andrea and I do the school lunchrooms and the childcare centers. So we can.
If it's specific to a center, when we come in, or if we need to come in and look at something, please let us know, because some of these are a little more specific. Oh goodness, they're going too fast here. What
If a
happened?
child brings in foods in lunchbox such as leftovers, it would need to be refrigerated and then heated up.
Say it has to be heated.
We don't address heating, although it would be a good idea before them. Okay, can you say it out loud, Cindy?
If a child brings in foods in lunchbox such as leftovers, it would need to be refrigerated and then heated.
It needs to be refrigerated, and if you're going to heat it, go ahead and heat it.
Heated in the kitchen.
Heat it in the kitchen, not in the classroom.
And if you use the microwave, as we stated earlier, you gotta heat it to 165.
But what, okay, not to be legalistic about things, but what about food that staff brings to share with other staff and it's on a communal table up front? That does not have to do with the children. I would not have an issue with that.
So-
You might not want to have the children to have access to communal food and a communal table, but if it's staff strictly, I'm not going to say anything about it, would you?
Mm-mm. If it's specifically for staff, we don't really look at that. But you want to make sure that kids can't have access to that,
Or you're not
or that you're
serving the
serving it.
kids.
Yeah, you're not serving the kids that food.
I would probably ask, and you would have
Yeah.
to tell me we're having a party or this is what we do. It's kind of like your staff break rooms. I look at them, but I'm only looking for stuff that's not been locked up in them. I'm not really looking for how you're doing your food, or I don't even check the staff refrigerators. Is it okay if staff bring food in and it's in the fridge in the classroom? I would say as long as it's not interfering with something else, yeah, I don't have a problem with that either. Depends on the situation.
Yeah, and I would say probably label it with the teacher's name so that we know that it's teacher
It's
food.
personal.
It's personal food. So, I mean, it should be okay to be stored in the refrigerator in the classroom for teachers, but just label it that it's teachers.
Writing them down. I have to get a copy of this.
Anything else?
I'll try to make it look a little neater. I hope, I don't know where it puts it when I tell it to.
I think you can save it to a specific area, Sharon said.
Can we get a copy of this?
Oh, you're welcome.
Any more questions, ladies and gentlemen?
And some of these questions that you're asking are kind of specific to certain centers.
And we'll be glad.
And
to
we'll be more than
work
happy
with
to work with
yeah.
you on those questions, because I know
That's awesome.
each center does different things sometimes. There's different situations, and so we don't mind coming and working with you on those situations, try to figure out a solution for you that meets the rules, but also works for you. I know that things come up and different situations come up, so I don't mind working with you at all. Any other questions before we head out? All right. All right. Well, if you don't have any other questions for us, we're going to go ahead and sign off for the day. We really appreciate you guys coming tonight and listening in on this class and talking to us about what you're seeing and what questions that you have. That helps us too, to know what you guys need more help with. And feel free, as I said, to use this as your resource. Cindy normally can come in and help do in-service trainings with you guys on things that are seen on inspections. So don't hesitate to ask.
I'm not regulatory.
And she's not regulatory, so what
she helps us.
I mean, she's here to help you. So please don't hesitate to call and ask for in-service. I mean, I don't mind even coming in and doing an in-service if I need to help your staff. So, I mean, I know our time right now is a little short, but I know Cindy is more than happy to help you with those things. So please reach out. And if you need those in services, please reach out and we'll be more than happy to help with that. we'll
I
find
think
time.
Cindy knows our rules almost as well as we do, or better than we do.
At most times, yes.
I know them, but I don't have to interpret.
Well, thank you guys again. And if you have any other questions, don't hesitate to reach out. And I hope you guys have a great night. Thank you guys.